Hey everybody, I am so glad that you are here today. We are going to be talking about this very, very difficult position you may find yourself in, and that is what to do if you need to secure a nurse practitioner preceptor. Now, I'd be willing to guess you're in one of two camps. You are somebody who's looking at going back to school, but you've heard all these ugly rumors that it may be really difficult to get your clinicals in. What does that even mean? So we're going to talk a little bit about the background on why this is such a big cultural national problem for us in the US. So I'll put a timestamp up in here somewhere if you want to skip past all that and get to the meat of the video, and that'll be probably addressing the rest of you who are in a situation where you are in school and something has fallen through, and or you just can't find a preceptor, or the school has promised you that they will secure one for you and lo and behold, they did not actually promise that. So now you're stuck and you got to find your own. So we're going to talk about what you need to do if you're going to battle with the school, number one, what the actual legal requirements of the school truly are, and the documents that you need to support your argument going forward. Number two, we're going to talk about how stepwise, 1, 2, 3, 4, 5, what exactly you do to hone your messaging so that when you're speaking with someone either in person or virtually to become a preceptor, what you can do to say to them to convince them that you are the best student in the entire world and that having you as a preceptee is going to change their life, or at least convince them to take you on. And lastly, I'm going to give you the laundry list of places that you can go to find preceptors. If we haven't met yet, my name is Bree. I'm an RN, NP, mentor, interview strategist, content creator, and educator. Welcome to the channel, friends. Okay, just a little bit of housekeeping first. If you're watching this, God willing, the creek don't rise, it is July 3rd on a Monday, and probably shortly after this is released is going to be the inaugural video that is going to be a part of my lecture series in the Acute Care Lab membership. If you guys haven't checked that out yet and you are someone who is an acute care student or an acute care new grad, particularly if you're going to work in a hospital, in a hospitalist role or an ICU role, this is where you want to be, friends. We're going to be doing bi-weekly lectures. You're going to have lots of PDF templates generated for you to use in clinical practice, along with a lot of other perks. So if this is something that sparks your interest, please do go check out my website at breenp.com to see if this is right for you. I'll include a link below, and maybe, just maybe, you'll have watched this in time and you'll be able to join us tonight. We're going to be talking about shock. All right, let's get past all that now. Why is this even a problem? It is absolutely infuriating to me, and I'm not even a student anymore, that we are in a state of education for advanced practice nurse practitioners that we cannot provide the training they need. It's so infuriating. It was never a problem. I don't ever remember even considering this when I was a nursing student. I don't believe it's a problem for nursing students anymore. I haven't heard this, at least. It's been a long time since I was in nursing school, but either way. I mean, we've always been sort of an eat the young type of educational system for nurses, and I don't like this. But I particularly don't like the fact that to advance your practice, you have to do so much independent study, spend so much money, and on top of that, possibly not even graduate because you can't get your clinical hours in. It's a travesty. But the problem exists for a reason, and I can't solely blame it on the schools. I have a lot of frustrations toward the schools. I have some bias there, but I can see from their perspective on why it's a problem. It's a problem because simple supply and demand. There are far more people who are NP students than there are NP preceptors that are willing to precept. Willing being the all caps key point there. There are a lot of NPs in the world, but many of them are not willing or capable or able to precept. Why? Well, first of all, you know why there's a lot of NP students right now. Everybody's trying to get out of bedside. We don't need to rehash that. Number two, precepting as a nurse practitioner. Now, I know this sounds bad, right? It sounds bad that there are not enough NPs willing to precept. Why wouldn't we want to do that? Why wouldn't we want to get out into practice and then give back? Why would we not want to advance our profession? It sounds ugly. I get it. I totally get it. I felt the same way as well. Until I became an NP preceptor and I realized, I mean, I knew when I was an NP student it was kind of tough, but I didn't realize how much until I became a preceptor myself. It's sort of like parenting, right? You know it's probably hard to be a parent, but you have no idea until you give birth. And then you're like, oh my God, they won't stop crying. You can't live your life anymore. It has changed your world. And then you get it, you know? Precepting as a nurse is as far from precepting as an NP as the East is from the West, friends. It's 180 degrees. Very, very different. And I just want to express this to you guys, just so that you know a little bit of background perspective on why NPs may say no. Number one, it takes a long time to become confident and competent in your craft to teach another human being as a nurse practitioner. As a nurse, it doesn't take quite as long. As an NP, it can take a year, 3 years, 5 years. The second thing is patient safety. That's really what it boils down to. As NPs, the burden of liability is way up here. As a nurse, it's high. As an NP, it's way, way up here. You're the provider, right? So everything you say, every order you do, every diagnosis or misdiagnosis you make, everything that you do affects another person's life. And the burden of that weighs heavily. So particularly when you're new and you're not at a point where this is all just kind of rote, like you can just get through it really, really fast because you've done it so much. When you're in the earlier stages of that, it's way, way harder to distract your focus. When you have someone constantly asking you questions or looking over your shoulder, your focus is not solely on your patient. It's divided. And so you miss things. And that's hard, okay? That's hard. So because it's going to take you much longer to get to a point where you can do this like secondhand, so that you can then also be distracted by someone's questions, it's going to take years sometimes. So there's just less people who are able to do that. Secondly, and possibly most importantly, is money. Y'all, it all boils down to money. As NPs, we are mostly salaried, or we are working on some type of revenue generation. So the amount of patients that we see, the efficiency that we see them with, the speed with which we see them, directly impacts our income. So if I am slowed down for any reason, I make less money, period. So money is a big motivator, y'all. I don't care who you are. We all go to work to make money. And if you are constantly taking on NP students in order to give back, in order to advance the profession and raise up new people, which I think all of us want to do, if it directly impacts my bottom line, I'm gonna have to really think twice about it. I've got to be able to, again, multitask and not be slowed down by someone. And it takes a while to get there, again. So I tell you all this just so that if you get a no from someone or a lot of someone's when you're asking them to be your preceptor, just understand that is a lot of the reason why. It is not a personal thing, and it is not because they don't care about you or the profession. It's just because they care about the bottom line a little bit more. Now, let's talk about schools. What is the school liable for? What are they legally required to do in order to maintain accreditation? You've probably heard a lot of rumors. You've probably heard all over the map, right? You have. And that is because it changes over time, and the messaging that I think the schools themselves put out there is gray. It's not very clear. It's also a little bit duplicitous. Some of the schools, in order to get your business and your dollars, are going to tell you they're going to do all of these things to help you secure clinical placement. The key word there is, friends, is help, support. Nowhere, I can guarantee you, almost nowhere in any piece of document from the school or from the accrediting bodies does it say that the schools are required to secure clinical placement for all students. There are very few schools who will promise you that. There are some who will. I chose a school that did promise that and did deliver on that and had a reputation for doing that, specifically because it was a big concern of mine. If you don't pick a school who is very implicit about guaranteeing placement, you're going to probably not get guaranteed placement. You're going to get support. What support looks like is all over the map. So let's talk about the accreditation requirement. Schools are evaluated for accreditation by the CCNE, the Collegiate Commission on Nursing Education. I think that's what it stands for, every 5 years. The CCNE uses a worksheet to demonstrate compliance as their checklist for what is required by the school for accreditation. I'm going to link a copy of the 2023 version below. Highly, highly, highly suggest if you are watching this video and in this camp, you print out this as well as another document I'm going to tell you about in just a second, and you have them in your arsenal, particularly if you are going to battle against the school because they promised you something that they're not delivering. Sometimes just letting the school know that you have read these documents, you're aware that they have to maintain accreditation, sometimes that is enough to kind of strong arm them into doing more for you. Now, this worksheet, aka checklist, is derived from a suggestion of criterion as determined by a consensus from a team called the National Task Force on Quality Nurse Practitioner Education for Criterion of Evaluation. There was no way I was going to be able to remember to say it to you, so I have to write it down. This is the other document that I'm going to tell you about, okay? The NTF is a conglomerate of accrediting, credentialing, and certifying bodies like AANP, AANC. I think there's like, what is it? NONPF. I think that's something on nurse practitioner faculty. I think that has to do with evaluation of the faculty at the schools, and AACN. There's a lot of different organizing bodies that come together and sit down. They become a task force and they decide what is it that we suggest the schools require, because we want standardization. That's our goal. They really do, these organizations really do fight for standardization. I think it should be higher, but that's my personal preference. Anyways, they come up with these list of criteria required by the school, and then the CCNE takes these recommendations and creates the checklist of requirements. Now, I think this is all good and well, right? These people are all coming together for the good, the greater good of the people. Or are they? What is important to remember is that the CCNE, their goal is in public safety, public health. Everything they do in regards to standardizing NP provider education is in protection of the public. That's their goal. It is not in protection of you as the student. I'm pausing for dramatic effect here because I want that to sink in. Their goals are not exactly what you think their goals are. And that's important. It's important because it helps you to understand the driving factor behind why they've chosen the things they've chosen to pick on or to require of the schools. And most of it is really around rigor of the faculty. How, is the faculty actively practicing? Are they competent to teach? Have they met all of these benchmarks? And the NP clinical preceptors and the preceptor sites. Are the sites robust enough? Are the preceptors robust enough? So a lot of the rules, like the bullet points that you'll see, are around making sure that all of that stuff is up to task. It's not, nowhere in this document does it say the schools should be required to guarantee that you secure placement. No, it's more in regards to the placement that you secure is rigorous enough. So that's one issue. The second issue is that there's a lot of loopholes in this document, in large part because the criteria, the bullet points, are vague. They're very, very vague. And even if they don't meet all of these criteria, there is a overall loophole at the end that says that if these points aren't made, all they have to do is show written documentation of a policy that's put in place about what they're doing to address these issues. So even if they do none of these things, all they got to do is say, here's what we're working on. So use these two documents if you're in an epic battle with the school. Thirdly, go to the accrediting body. I think it's the Accreditation Review Committee Board. Okay, this is part of the CCNE. I'm going to put the address down below. Send a complaint there. Highly, highly, highly suggest if you're having major issues with your school that you do this. If these accrediting bodies are not aware there's a problem, they won't do investigations. So you need to send forward your complaints if they're legitimate. Having said all that, I do want to support the schools a little bit in saying that this is a very, very challenging task. They can't do anything about the fact that there just aren't enough people out there to teach. So they're trying. They are trying. I really do genuinely believe they're trying. But unless it's a place it's a school that is affiliated with a school of medicine, a university health system, or is a training institution, it's going to be very, very hard to have enough places to put you in, particularly if you're not local. They may be able to provide you something like, say, Vanderbilt. I know that Vanderbilt will secure locations, but you got to be local, right? If you're doing Vanderbilt remote, how are they going to help you in Kentucky? So it's a challenge. It's a challenge across the board. There's no easy answers to it, and the school's only going to be able to do so much for you. Okay, so networking. This is key, y'all. This is key. Your messaging, how you present what your needs and wants are, and trying to align them with what they're willing to provide for you is key. Anytime you are asking someone to do a big favor for you, and we already outlined why this is hard for preceptors, so they're doing you a big favor. Anytime you're asking someone to do a big favor for you, make it easy for them. Help me help you. I actually just saw this clip, I think it was on TikTok, from Jerry Maguire, where Tom Cruise is in the bathroom and he's talking to his athlete. He's the athlete rep, and he's talking to him about what he can do to try and get him work. He's like, help me, help you. And he's like losing his mind, losing his mind. But it's very effective. Same thing here, right? If you're asking someone to help you, you gotta make it easy for them, friends. You gotta make it easy for them. Hone in your messaging. First step is you need to develop an elevator pitch if you don't already have one. If you don't know what an elevator pitch is, just Google it, do some YouTube searches. I'm sure there are plenty of videos out there where people teach you how to make an elevator speech. But this is basically a couple minute long speech that you would deliver to someone. Say you were stuck on the elevator with the hiring manager for your dream job. How would you very concisely, quickly, and very effectively induce the emotion from this other person that they really want to know more about you? It's an introduction, right? You're not giving your whole life story, but you're giving your background, what it is that you're looking for, what it is that you can offer them in return, so that they're intrigued, so they want to know more. So your strategy is, when you're talking with someone, whether it's virtually or in person, you're delivering this elevator speech and you're following it up with documentation, papers, something they can hold or see and refer back to later, so they don't have to remember your name and your phone number, because they won't. And this goes on to the second step, which is where you're going to create your calling card. I'm going to put a link up here to a video where I talk about the calling card. Now, in this video, I believe I was talking about it in regards to obtaining a job, but the same thing is applied here. You are looking for a position, just not necessarily a job. So you're going to utilize it in the same way. And in that video, I take you stepwise how I created one in Canva and how you can as well. You're just going to tweak your messaging on this card a little bit. Essentially, it's bigger than a business card. It's like a postcard size card, basically, that's either virtual that you send to someone, or that you have in your hand that you give to someone. And on the front of it, it's going to have your name, it's going to have, NP elect, it's going to have the school that you're going to. You're going to flip it over. It's going to give a little bit of your background, 7 years as a nurse with experience in acute care roles, ICU, ER, whatever. And then you're going to say, looking for 160 hours in the fall, specifically for this type of rotation. You're going to put somewhere on there what your school is and your contact info. And that's it. So it's very, very concise. It's not the full picture, but it's just enough so that you can give that to them and they can be like, oh yeah, I remember talking to this person, and they can pull it out later. It's a reminder. Thirdly is dust off your resume. You need to have a resume for everything that you're doing in life. When I have clients who come to me who are looking for jobs, I always advise that they have lots of different resumes. You're going to want to have one resume to send to this particular type of job. You're going to want to have a different resume that you send to a different type of job, because different jobs are looking for different skill sets, and you want to show how the skill sets that you have support that kind of job. So you're going to want to highlight different things. So you're going to want to change your messaging based on who you're talking to. And it's not being duplicitous, it's just sharing the side of you that most fits with that thing. You also want to have a resume for this. You're going to want to, when you go on Facebook forums, when you're sending emails, when you're sending over the more information, when that person comes back to you, you're going to include in it your resume. So they know the background that you've had, so they know where to start teaching you from, or how much are they going to have to give you? How much time are they going to have to spend with you? How much teaching are they going to have to spend with you? A resume helps them to determine this. Okay, and the last part of networking is your messaging. Okay, this is key. You have to be able to articulate what it is that you need, what it is that you offer, so that people can determine very quickly whether or not they're able to help you. We're going back to that help me help you. Help me help you. Help me help you. I want to give you an example. Now, you may think after hearing this that I'm a condescending jerk, and that's okay. I deal in reality here, friends. I hope that you guys know I am your biggest supporter. This entire platform and everything that I do in life is to help support you. But I'm also a tough love kind of person, right? This is the reality of the world. So I need you to understand the reality so that we can then move forward from things. So I don't say any of these things from a place of trying to be a jerk. This is just reality, okay? And you'll realize once you get out into the world. I am on a lot of nurse practitioner forums, and there are so many great forums out there, whether it's on Facebook, LinkedIn, Instagram, so many different social platforms that offer groups of support, like specialized groups. Highly, highly, highly suggest you utilize them. I can't tell you how many times a day you see some generic posting from a student who just says, hey guys, I'm an NP student, I'm looking for a preceptor for this fall. Y'all, First of all, very few people comment on this, very few people like it, very few people engage in it. Why? Because you've given me no information for me to quickly determine whether or not I can help you. And I'll be honest, if it's a lot of work for me, I'm not going to dig into it and figure out what it is that you need. I don't have time for that. This is your job, not mine. Here's the problem with that. I don't know what certification you're in. I'm acute care. I cannot teach FNPs. I cannot teach psych mental health. I cannot teach PEDS. You haven't even told me what type of program you're in that you need, number one. Number two, I don't know how many hours you need, whether or not, I may already have a student lined up for the fall, but I may have 5 shifts I could give you. Give me some more information about how much time you need. Give me some more information about whether or not you're a good fit. Not everybody in my world in ICU needs to do an ICU rotation or is appropriate for an ICU rotation. What are your goals? What are you wanting to do when you get out of school? What is your background? What rotations have you done so far? I never suggest that somebody, even in an acute care role, does their ICU rotation very, very first. It's hard because you've got all the ICU stuff to learn, critical care, complex problems, on top of learning how to write a note, on top of learning how to take a history, interview a patient, do an exam. Start with those foundations first. So it's important to me to know where you're at in your training, what you've done so far, what your background as a nurse is. All of these factors are relevant to determine, number one, if we're a good fit, and number two, how best I can serve you. Where do we start from? How much do you need? Here is an example of a very well-written post. And I'm just gonna have to read it to you. Forgive me for not looking at the screen here. Hi, my name is Bree. I'm an FNP student in my first semester at ABC University in Georgia. I dream of becoming an FNP with a focus in cardiology. As such, I am in need of 100 hours of clinical rotations within a pediatrics field of practice this fall. I bring 4 years of experience as an RN. I'm a great listener, easily redirected, and offer you a committed, passionate student from a state university, which qualifies you for the Preceptor Tax Incentive Program. I can provide references from previous preceptors on request. Thank you for your consideration. And you may link either your resume or that calling card or something that has more information on it and or your picture. Pictures always help, just because people notice posts more when there's a picture attached to it. All right, so now your messaging is all tightened up and honed in. Where do you go to find these magical people? There are options for you. First of all, start with the school. Okay, I know I already talked about school. I'm not talking about battling the school to do the work for you. I'm talking about within the school. So everybody in your cohort, who did they use last time? Who do they recommend? Alumni. Is there an alumni association? Maybe there's a Facebook alumni group you could get on board with. Sometimes there's the previous class. Like when I was in school, there was a Facebook group for my cohort, and there was a Facebook group for the previous cohort. Previous cohort is a great place to go, y'all, because they've already done those rotations. They know who was a good preceptor and liked taking students and who didn't. Go to those people. Possibly teachers, possibly guest lecturers. I was at a university system, so when the lecturers came in, many of them did take students. You can go to physicians, you can go to PAs, you can go to NPs. Now, not all schools and not all programs will allow you to use physicians and PAs, but most will. You're just gonna have to check with your school. Secondly is work. Probably, actually, maybe even the most important place. I know people who have employed a strategy where they took PRN jobs at other hospital systems just to network and meet other people. I think this is highly effective. Granted, you're gonna be doing more work. That's the downside to it, and you're probably already in school. So you gotta decide what kind of time frame you have to do. But if you're the kind of person who's watching this and considering going back to school, think about doing this in advance. Maybe you cut down to PRN and just have a couple of different PRN jobs. You have the ultimate networking there, and you probably are going to be able to get everything you need. So you're not just going to be hitting up the people you know, you're going to be asking the people you know who they know, right? So you know somebody who's willing to precept you or precepted you in the past. Hey, do you know anybody in ID? I need a specific rotation in ID next semester. Utilize that strategy I talked about before with the elevator pitch, the calling card, the resume, but especially if you can do it in person. People have a much harder time saying no in person than they do if it's just an email format. We're like, oh, I never saw that. Next is going to be your personal life. Reach out to everybody you know. You never know who knows somebody who is a family practice doctor over in Cleveland, Ohio, and it's not that far for you. You could also ask your own doctors. I know plenty of people who have done this. Some will be willing to do that. Next is going to be local organizations. So local chapters of AANP, APRN groups. Some places have student association groups that are local, like statewide or county. Definitely join those, y'all. Those are phenomenal places to go for any kind of networking, not just for preceptors, but for job acquisition, for things that you need as your practice goes on. It is really powerful to network with people in person that you know locally. A lot of the time when you get to know these folks, they are very invested in you and your personal growth. Not a lot of NP students go to these type of meetings, so I think it is highly valuable to do so. You're going to have a lot of people who are out in practice who are willing to fight for you, who are willing to find you someone, or willing to do it for you directly. So definitely utilize local chapters. Next is going to be your online options, and there are a lot of them. So LinkedIn is huge, my friends. Shore up your LinkedIn site. Make sure everything is tight, buttoned up. You maybe even have your resume front and center there, exactly saying what you need. Keep it updated every semester so you know going forward what it is you need. You're going to need to secure preceptors way in advance, y'all, like a year in advance. And I will tell you from the preceptor side, a lot of people will hit me up, hey, I'm going back to school next year. Will you be my preceptor? Sure. I'll say yes, but if you don't give me a specific semester or even more than that, the specific months that you need me, the first person who asks me is the one who gets it. The first person who's closest to, I need 15 shifts between April and July, you got it. You're the first person who asks that specific stuff, because it's very hard to hold out years in advance to hold a spot for someone if you don't know exactly what it is they need. And I've had, I would say probably 50% of these people never actually show up. They either don't end up going to school, or they don't end up needing a rotation with me, or something changes. So yeah, I'll usually say, yeah, I'm willing to take most people. You know, I stay booked out about a year in advance though, y'all. So the first person who comes in and says, I need a winter rotation between these months, they got it. But I digress, back to the LinkedIn. So not only are you going to make sure that your landing page is shored up, you're also going to start using that as a search engine. You are going to search in your region, where you're at, how far you're willing to travel. You're going to search for nurse practitioners in the certain specific field that you're looking for. What certification? Make sure their certification matches up with yours, and literally just DM them. Hey, I'm an NP student. Use those networking strategies. Reach out to them. Tell them, hey, can I send you my resume? What can I do to entice you to want to take me as a student? Another trick is search your state. A lot of states, and I don't know which ones do and which ones don't, I know mine does, offers a tax incentive program for people who are going to in-state schools. So I'm in Georgia. If I take a student from a state school in Georgia, I get a direct tax credit. And it's not a deduction, it is a credit. So I think that Georgia, I'm going to say this wrong because I haven't looked in a minute, but Georgia allows up to, I want to say 7,500 or 5,000 or 7,500, something like that, dollars per year as a tax credit, a direct tax credit. So you want to make sure, because a lot of preceptors are not aware of this, search your area. Does your state offer it? And then if you haven't, you know, hopefully you're in you have to be in a state school though. This is the problem. So you can't be in a online only non-local school. It has to be a local. If you are in one of those schools, kudos to you. You're probably going to have a much easier time getting rotations. Facebook forums is another online site. Go to that search tab for groups on Facebook and search for groups in your state, in your specialty, in your region, and go on there, use the search little icon and search for preceptors. Just type in the word preceptor and see what people have posted in the past. See who has posted comments on those posts to see if there were people who said, hey, sure, I'll be willing to help you. DM that person, y'all. Do a little work, do some digging. Post that really well-written request that we already talked about on those forums. Also online, and this is probably further on down the line, right? Because this is going to be your cold calling strategy. This is truly cold calling. So you're going to search for all the clinics or sites in your area. So if you are, let's go back to primary care. Let's say you're wanting to do primary care, you're FNP, you need to do primary care rotation. Search for all the internal medicine or primary care clinics in whatever your geographic region is that you're willing to travel. List them all out and just go one by one by one. It helps if you can do it in person because, again, people have a harder time saying no in person. Walk in the door, introduce yourself, ask for the office manager. Because the first person you walk up to is going to be a receptionist or, they're going to be checking people in, taking payments. They're not going to know all the backhand stuff in the office. So you're going to want to ask for the office manager, and you're going to say, hey, I'm a nurse practitioner student. I'm looking for a rotation in primary care. Would it be okay if I speak with your office manager? When the office manager comes out, you're going to tell them what you're looking for, when you're looking for it, and you're going to ask them if you can leave them your resume or your calling card, and then you're going to walk out. And you may have to do this 30, 50 times in order to get 1 or 2 callbacks, but it is what it is, friends. I never had to do this kind of searching. I was not looking for some of those difficult rotations like peds and OB, but I hear from Nurse Liz, who has made a nice video on this as well, which I will link below as well if you're in that boat, who talks about the fact that you need to really vet the sources of these cold calling places that you're going to, focusing in on the inner city, federally health qualified centers, kind of avoiding some of the teaching institutions or those who are affiliated with university systems. And makes perfect sense to me. I went to Emory, and most of the clinics and rotations at Emory only took Emory students, because they have so many medical residents, NP residents, then they have NP students, PAs, all of them that they've got a place. So they prefer to take Emory students. So they're swamped with students. So you could try, but unless you really know someone, you're probably not going to get in there. So focus your efforts towards more of those private practice, underfunded, inner city kind of places. It'll be a little bit easier for you to get in with those kind of sites. Another site you should look into is called ENP Preceptor Matching. And in there will be a folder, I think it's a tab that says, I think it's Preceptor Pass. I believe it's Preceptor Pass. You click that, it's going to give you a list of people in your region, and then you can start cold calling from there. Also look at the AANP's website on the NP Finder. Last but not least is going to be your independent payment company. So there are a lot of third-party sites that will connect NPs and NP students together for a fee, and it's hefty, and I really hate that it costs so much. It is what it is. There are plenty of people who will utilize this strategy. They pick a school that they know is not going to help them much. Maybe they've been doing travel nursing for a while. They don't have a lot of places they can network with. They don't know a lot of people because they've been in this world of traveling for a bit, and they're kind of nomads. They're not stuck in one spot. It's harder to network when you're not in one spot. So a lot of people will do this. They'll pick an online school that allows them the flexibility to continue that kind of work, and then they'll pick one that's a little on the lower price range, and they'll just chalk it up. I'm going to have this much money I'm going to have to spend to pay a preceptor, and they don't stress about it. I've met people like that. They don't have any stresses about it because they knew going into it that they were going to have to pay this up front. It is certainly a strategy you could use. If you're going to do this, I highly advise that you use one of these third-party sites, because there are some bureaucratic paperwork stuff that has to be done. And if you don't know what you're doing, you may miss this, and you could do a whole rotation and then it not be approved by the school. So make sure that you are really, really tight with the people at your school, like the clinical site placement coordinators, and knowing what exactly it is they need from you, and start getting this stuff early on from the preceptors. But a third-party vendor like NP Hub will do all of this for you, and they make sure that the preceptors that they're putting out there to you are already vetted from that perspective. So it just makes things a whole lot easier. And easier with money if it means that it's going to cause you to, not having that would cause you to have to delay graduation another semester or 2 semesters even, can really reap dividends in how much you would make making a bigger salary as an NP. So again, a lot of independent factors you're going to have to weigh there for your specific situation, but it is an option. I highly advise, if you're going to go this route, that you request to have an interview with the preceptor. Look at the reviews, people who've been with this preceptor before, to make sure this is somebody who actually likes to teach. This is not somebody, because there are bad eggs everywhere, y'all. There are people who are going to be doing this because it makes them extra income. They're going to bring students on. They're going to let them sit in the corner and shadow all day. That is a terrible rotation for you. It doesn't serve anyone well, except maybe this person who's getting this money. But it's not good practice. You don't want that. So interview this person, look at who's had them before, make sure that this is somebody who's going to actively engage you in your learning. You want to have a good rotation, particularly if you're paying out of pocket for it. Okay, that's all I got for you. I know this is a little bit on the longer side video. I apologize for that. But hopefully this will give you all of the tasks that you need to complete in order to get out there and get the preceptor you need. I pray that you all are able to secure rotations with ease and not going through this struggle bus. But if you are, I send you all the love, hugs, and good vibes virtually. And if you're watching this and it is not too late, please do go check out the Acute Care Lab to see if you can join us tonight for our lecture on shock, where you learn all the things you need to do as far as differentiating shock, treating shock, what the medications are, what the etiologies are, all the things you ever wanted to know. Thanks for watching, friends.